It's live with CCO. We're on episode number 55, and we've got a fun topic. We have a lot of people ask about Z codes. Well, guess what? Z codes are exciting. However, they can be intimidating because they're not codes that we use a whole lot when you're in a course. They'll highlight, they'll talk about them a little bit. They're accent codes. I kind of think of them as accents. However, the bulk of the education that you get is on the guidelines, and there are some guidelines regarding Z codes, but you don't get the exposure that you really need in a typical course over Z codes. And we are going to talk about those and kind of give you an idea of the possibilities or what's actually out there in Z codes. Now, Z codes, for the most part, just tell the rest of the story. That's what I tell my students. If you want to know what a Z code is, then when you open up your manual and you look at the first line, it'll state factors influencing health status and contact with health services. But that's broad. That is all Z codes. And you notice that the code range is Z00 through Z99. Well, right there is a range of 100 categories. That's a lot of Z codes. Again, it's very intimidating. But once you get in there and you play around and you kind of expose yourself to the possibilities that are available to you in these codes, they start making a little more sense. And that's what we're going to do. We're going to go over them briefly in the slide deck. Then I'm going to bring in Find a Code and show you the categories again and talk about what codes are available in these sections of Z codes. I really like Z codes. They can be fun. They are some of the ways that if you have to have a game or some fun thing, maybe in your local chapter or in your class, if you want to come up with a game in your course, or maybe you're an educator and you want to come up with a game, Z codes will help you do that. Let's talk about the division of Z codes first. Now, I've got a couple slides on this because again, we've got Z00 through Z99. A lot to go over, but it's divided up very efficiently. So the first and one of the most common areas for prophy coders in outpatient that you'll use is the Z00 codes, or that first section, Z00 through Z13, persons encountering health services for examinations. Basically, if we want to describe why a person's being seen and they're healthy, you can't put a diagnosis in there because they may not have one yet. Then you use a Z code. You have to explain, why did the patient come in to see the provider? Well, there isn't always a CPT E&M that is applicable for that. So we can use a Z code. We'll talk more about those. Then we move on to our next section, Z14 through 15, genetic carriers and genetic susceptibility of disease. And again, it's exactly what you think it is. We're talking about identifying genetic carriers. Z16, resistance to antimicrobial drugs. This category is where we start looking at things like uh, uh, drug resistant methicillin, or things like MRSA. Z17, estrogen receptor status. When the best way to describe this is when you get breast cancer or certain types of cancers that are fed off estrogen, they use this to identify it. Now, good time to bring up what I'm always saying, and I know you might get tired of me saying this, but it's the truth. Don't forget, we code for statistical purposes. It happens to be a convenient way to get paid. How do we know the number of women that get breast cancer that are estrogen positive versus estrogen negative for this Z code? How do we know the treatments that are working for that patient, that diagnoses, is effective or non-effective, those Z codes with the CPT codes or the ICD-10 PCS codes. It's all tracked. Not only are we translating, we are tracking the statistics for analytics. Moving on, Z18, retained foreign body fragments. Z19, hormone sensitivity malignancy status. Again, Z17 has its own code, estrogen receptor status, but look, the hormone sensitivity malignancy status, because we're tracking the cancers run on hormones. Now, that's take that with a grain of salt. What I'm saying is that as we've studied cancer for so many decades, we have come to learn that hormones play a part in that, in the way that uh, cancer cells move in the body, as well as the treatments for cancer and the predominance of cancer for certain hormone levels. And hormones is a very broad set statement as well. Z20 through Z29, persons with potential health hazards related to communicable diseases. If you have hepatitis, guess what? They track that. If you have tuberculosis, they track that. If you have COVID, they track that. So that's where you'll see those codes come up. Z30 through Z39, person encountering health services and circumstances related to reproduction. If you are having trouble conceiving and you go to a reproduction specialist, this would fall in that category, because you're not going to the provider because you're sick. No, you are going to a provider to have services rendered in helping you or assisting you to conceive. Z40 through Z53, encounters for other specific health care. We'll look at some subcategories in all of these. Z55 through Z65, persons with potential health hazards related to socioeconomic, physiosocial circumstances or psychosocial circumstances. This area is really getting a lot of attention right now. We're seeing it being used more and more with especially primary care providers, reminding them that these codes are available, uh, talking about homelessness, inability to purchase prescriptions because they don't have enough money, things like not being able to. Homeless, but why are you homeless? Are you homeless because you choose to be there because you lost your job, or homeless because you got kicked out of where you were living, or your house was repossessed? They can get really specific. Let's move on to the next slide, and then we'll break down these in more depth. Do not resuscitate status, Z66. This is a decision that's made between the provider and the patient, and this code will be appended to the patient's chart so that they know that they have chosen to be a do not resuscitate patient. Z67, blood type. Z68, body mass index. I use this code every day. I'm looking at these codes, especially morbid obesity, when a patient's E66.01 or Z66, excuse me, E, not Z, E66.2. That's morbid obesity and morbid obesity with hypoventilation issues. But Z68.41 is the BMI starting at 40, which risk adjusts, and that's what I do a lot of work in. So I am always mindful of that BMI. And some providers like to use the BMI because they don't want to put the E66.01 code on the patient's chart, because when they walk away from the office, when they pull that piece of paper out that they used to not get, but they get now, and it says morbidly obese, then they get upset with the provider, and we know that you can't do that. Jane makes a good point. She says, you use this Z6 code with the E66 together if the body fat percentage is recorded. Correct. Now, just a little caveat to that, keep in mind, you cannot code or for risk adjustment, especially, but you have to have the E66.01 morbid obesity or the obesity code for the Z68 code to count, right? Again, you just because you have a BMI and the clinician captures that when they put in the vital signs, um, the provider still needs to state in their documentation where the patient's obese or morbidly obese, etc. Let's see, we are down to Z69 through Z67, person and counting health services and other circumstances. Very ambiguous. Like, what does that mean? We'll talk about it. Z77.Z99, that ranges persons with potential health hazards related to family and personal history and certain conditions influencing health status. Again, when you're a student, especially, or when you first start using Z codes and you look at that and you're thinking, potential health hazard related to family and personal history? What in the world does that mean? And then conditioning influencing health status. Uh, so the best way to become familiar with these codes is to have your manual open and just flip through those Z codes. I like to smirk that it's a little light reading in the afternoon, but some of these codes are quite humorous and fun. Uh, Miriam says, I've worked with orthos and they are very fun and good to explain complexity. Yes, some of the specialists are much better than others. I have enjoyed some of the fabulous uh, videos out there, some providers making fun of other specialties. So, what I did was I opened up my Find a Code and I went ahead and just went into browse a code. I'm going to show you how to get there. So you would go into codes, go into the diagnoses. Oh, okay. And then look over here, browse a code and see how it says fast and fun. Yeah, it is. If you're have trouble following into a rabbit hole, you could easily do that. And because I love the diagnoses and all the diagnosis codes, then I fall into a rabbit hole a lot. Notice how not all of them fit on the page. So this is the ranges, and ultimately you can just do a drop down and pick one of those ranges. So I'm just going to go straight to the Z codes, which is down here: factors influencing health status and contact with health services. So I'm going to do the drop down, which allows me to see the breakdown that I just read to you, kind of a quick range. Now, the very common area that you're going to most likely be tested on the first one will be the Z00 codes if you're a student. So you need to pay attention to those. And there is something unique about those codes that you need to be aware of. The Let's just look at the first section here. Encounter 4, general examination without complaint, suspected or reported diagnosis. Then look at the other one, Z01, encounter for other special examinations without complaint, suspected or reported diagnosis. That's very important. Now, let's just go ahead and look at the top range, Z00.00. I always remember this code as the zoo code. It means you went to the doctor, you don't have anything wrong with you, but you've got to go to the doctor, whether it be for a specific visit or get refills or whatever. And usually when you go to the doctor and you're in the waiting room, it can be quite a zoo. That's how I remember it. So let's look at the example. The zoo code is two parts. You have point zero zero and point zero 0.01. You've got an encounter for an adult medical exam. That's the first thing, because there's one for pediatrics and adults without abnormal findings. So I went to the doctor. There's nothing wrong with me, and what are they gonna put down as the code? The ICD code. You have to have an ICD code or you can't be treated, and that would be the Z code, zoo code. But there is Z00.01, same thing except with abnormal findings. Now, we can look at this code and I can show you. Let me open it up in another link to give you a better idea, but we're not going to spend a whole lot of time talking about the individual codes per se. I want to give you exposure to these codes so that you can go and do the research yourself and become familiar with them. So here's our without abnormal findings. Perfect way to explain it: encounter for adult health checkup, not otherwise specified. So don't forget, this is going to exclude if you're a child, this code isn't applicable. There is a there's a zoo code for you if you're a child, Z00.12. Examination for administrative purposes, no. And let's see, related to pregnancy, of course, they have their own um, set of Z codes for pregnancy and reproduction. So this is just a breakdown of the main categories of those encounter codes. And I don't want to go over those right now. Now, it's real easy. I can go back to the Z codes for general examination. I can go back to the previous code box. Look there. Isn't that really cool? It takes me all the way back to where I was at. I thought that was kind of fun. Um, and I can go to next codes or return to start, but I'm going to just return to start. I'm going to go back to my Z codes, the very beginning, just because I want to again show you how to navigate this, whether you use this one or not. The persons encountering health services, just real quick, we talk about going to the doctor without having anything wrong with you, with special complaints, administrative examinations. What do you think those are? That's where you have to be seen for a specific reason, like pre-employment exams. What do? You're not sick, right? And the place you're going to work has required that you have a pre-employment exam. This is very common. And so how do we code that? You Z02.1, because you're not paying for this. Your insurance is not paying for it. The prospective employer will pay for that. And let's see, admission to residential institution. That would be uh, if your loved one is going into a skilled facility and they need to have an exam before they go to make sure that one, they're qualified, because some uh, skilled facilities or assisted living, you have to be able to ambulate by yourself to the bathroom, or you have the ability to be able to drive and leave if you want, and they want all of that record in your file before you live there, so that they know that you get the care you need, but you also have the freedom that you are entitled. Let's see, recruitment for the armed forces, your driver's license, participation in a sport, so a sports physical, insurance purposes. If you want to get a life insurance policy, you have to get have this exam. Now, there is some other ones here for issue of medical certificate. Those could be like disability, determining that you are on disability, or other medical certificates. Let's go back. Oops, I shouldn't have hit that. Caught as soon as I did it, I realized I shouldn't hit the back button. That's one of those things. Don't hit the back button. Uh, Again, just do a review on your own of Z00 through Z13 and realize that those codes are specifically for why a person is going to the provider. Let's move on. Genetic carrier and genetic susceptibility to diseases. Now let's just review. If are you a genetic carrier of? Do you have a genetic susceptibility to a disease? Uh, I know that I can use a specific one that my daughter said that her son and she tested positive for. So she said, you or, her father need to be tested to see if, obviously one of us would carry this code, or both. So I went and got tested and I was. And so it's not that big of a deal, but they needed to know, because it was going to change some of their plans with the children on some treatments and things that they were going to do for the children. So that's would be the codes that would be used if you were being treated with those. Okay, let's go. Let's see if next code. Resistance to antimicrobial, I can't hardly say that. Resistance to beta lactam antibiotics, other antibiotics, and antimicrobial. These are the ones I'm more familiar with. Antiparasitic, antifungal, antiviral. There is a lot of ones here that if you click on this, let's see, antiviral, since we talk about those so often, let's look at one. So resistance to antiviral drugs. Oh, I thought it would give me a little more information. Now, note they're telling you, hey, this isn't the same as an antiviral. It's not the same as an antibiotic. So heads up. And then it excludes this methicillin resistant and sepsis due to methicillin resistant Staphylococcus aureus, which is MRSA that I mentioned before. Okay, let's go into, if I can click on the, I think it'll give me the next code. I like how it does that. I hope that doesn't make you dizzy. Estrogen receptor positive, ER positive or negative. When my mother had breast cancer, they tested her and she was ER positive, which just stands for estrogen receptor positive. So that makes a difference in the medication and the treatment that you're given for your breast cancer. So she takes medication now after her breast cancer has been eradicated, then she'll still take, I think, for 10 years, this medication. The way I understand it is it suppresses the estrogen. Next, we're going into retained foreign body fragments. Well, radioactive fragments, would you even thought of that? Metal fragments. Why would you have retained metal fragments? Let's just look. Or organic fragments, retain foreign bodies, but let's look at this metal fragment one because I think that's interesting. So unspecified magnetic and non-magnetic metal fragments retained, meaning that let's see, let's just do magnetic, retained magnetic, and it didn't give us any more. Sometimes Find a Code is brilliant about giving you more information about a scenario, kind of that helps explain it, but that one didn't. Why would a person have a retained metal fragment, a magnetic metal fragment? Now, the only thing I can think of off the top of my head is in your head if you have a cochlear implant. That is actually a magnet that's put in the back of the head. And my niece has one. So that's how I know about that. But it's a magnet, and then her cochlear device attaches to that. And it's retained, it stays in the body. Animal quills or spines retained. You've seen that in dogs, right? Have you seen those pictures where the dogs have quills all over their face? Let me just look over here. Let's see, only with abnormalities. C55 through C65 is to support MDM and risk level codes. Yes, that is correct, Miriam. Christy says, or if you're a welder and exposed to metal while welding, yes, that's right. I remember one time my husband had something on his arm, kind of like on his back of his shoulder. And I couldn't figure out what it is. And I kind of looked and I was like, oh my word, it's like a splinter. And I was able to push on it and it looked like someone had broken a pencil lead into his shoulder, but it actually was a metal shaving that had probably been there for quite a while and he didn't know it was there. So that's a great example. Retained tooth, retained wood fragments, and other retained organic fragments. Now, the reason it's is good to go through these to get a better idea about them and what's possible is you may not have realized there's a difference between retained wood fragments or other retained organic fragments, right? I would think wood is organic, but there's other organic fragments or things that could be left in the body. Retained tooth, that's a good one. I like that one too. Let's see, retained glass, stone or crystalline fragments, and specified retained foreign body fragments. that would be that it's specified, but there isn't a code for it yet. So it doesn't meet any of the other criteria. Then we move on to Z19, hormone sensitivity malignancy status, sort of like having the code for the receptor. Let me get rid of some of these and let's just sensitivity and resistant. So let's just look at sensitivity first, see if there's any. Go to the neoplasm table first. No, it's just telling you that uh, that's available, and you will see that in the documentation. All right, moving on to this, getting exposed to these great codes. Contact with and suspected exposure to communicable diseases. This is where when you look at him, you think, oh, yeah, that's a communicable disease, but you may not have realized it, or you might not be able to think of them off the top of your head. Tuberculosis is the one that I think of. We don't really have a lot of tuberculosis. I mean, it's still out there, but not like we used to have because we have so many wonderful preventative measures and you're tested for tuberculosis. That is that TB test that you get under the skin. They make the little bubble, and that has been wonderful to help kind of eradicate if you're going to be in an area or exposed to people where you could transmit something. And a lot of people have to have tuberculosis tests for different jobs. Let's see. So we've got intestinal infection disease, tuberculosis, sexual mode of transmission, rabies, rubella, viral hepatitis, human immunodeficiency virus, which is HIV. Let's see. Pediculosis and other infestations, suspected exposure to other communicable diseases, which I'm not going to click on that, but again, it gives you a broader list of other communicable diseases that you could have been exposed to. Carrier of typhoid, intestinal diseases, diphtheria. Let's see, keep going. Now, these are carriers, not that you're exposed, you actually carry it. Latent tuberculosis, meaning you test positive for tuberculosis, but you don't have it. You're not sick with tuberculosis. Infectious diseases, other is defined by the code set as we've identified it. The documentation identifies it. There's just not a code for it yet. And then that the next thought is unspecified, where it isn't. We aren't identifying it in the documentation, or was just not put in there at all, or they don't know yet. So again, other and unspecified is very pertinent to have for your code sets. Excuse me, my nose was feeling drippy. Let's move on. Isn't this fun? All right. Immunization not carried out and under immunization status. So, out, let's see, not carried out because of a contradiction that you weren't able to have that particular immunization. And there's people that are allergic to certain immunizations. My mother was allergic to tetanus, but that was as a child. And so they would never give her a tetanus shot after the first one, or maybe the second one that she had, when they realized she's allergic. And they used to call that horse tetanus, I think. And they've improved it and synthesized it since then, so she could have one probably now. Let's see, because of a patient's belief, patient's decision for other and unspecified reason. They're just an under immunized status and not carried out for other reasons. So, why are we documenting this? Statistical purposes. We need to know that this person has a contradiction. So, therefore, they weren't given tetanus because it's protocol to give tetanus if you haven't had one in 10 years, and etc. Then we, let's see, encounter for prophylactic immunotherapy, fluoride administration. That's when they used to do the teeth. Remember when you used to get the fluoride treatment when you were in school? I don't know if they do that anymore. Prophylactic measures, specified prophylactic measures, and unspecified. Look how we're whipping through these guys. And again, did you know that some of these existed? Is this new to you? I'm curious for you to let us know. It's pretty fun, again, like I said. Encounter for general counseling and advice on contraceptives. So, contraceptive management. That's a different area of reproduction medicine, and is it's broad within itself, but specifically has one theme. And so the first thing is getting counseling with a provider. What contraception would you want to use, what's available to use, and also to talk about what is best for you with maybe specific medical conditions that you have. And then there's also encounter for sterilization. This would be for male and female that could be used. Encounter for surveillance of contraceptives. So, in other words, the only reason that you're going is because you're needing to get a refill. Encounter for contraceptive management. Actually, that would be contraceptive management would be that. Surveillance would be, hey, maybe you're having complications or they need you to check back in. So you have that for other contraceptive management and for unspecified. And that still applies, other and unspecified. That is those terms are consistent through all of the ICD-10 code set. So now we move into encounter for procreative management. Now, this is not the same as the previous section because contraceptive is to prevent pregnancy, and procreative management is to create life. So we have reversal of previous sterilization that can be done for men and women, procreative investigating and testing. So you're going to see, is this even a possibility? Are we candidates, etc.? Genetic counseling. So this would say you have had some genetic testing, and you have a particular condition that has shown up several times in your past family history, and you need to know if this is something that could occur in your children. uh, General counseling and advice on procreation, uh, gestational carrier, as well as other and unspecified. And let's see. The new Z codes come out for under immunization April 1st, right? Yes, I do believe you are correct, Lisa. What they've started doing now with ICD 10, since COVID came out and it was unprecedented that they implemented codes in the middle of the year, they decided to update them in the middle of the year for the next year. And guess what? It worked out so well that now they are going to drop codes in the middle of the year on April 1st. So it is a relatively new thing. Uh, let's see. Miriam says, "Oh, I've coded that for workers' comp injuries." Yep, that you were right. You were going back to some of the other examples that we gave, and oh, Miriam said Z18.39 for retained palm tree branch. That is hilarious. Yes. Yeah, I see she did it twice because she didn't get branch typed in there. That's okay. But there is amazing things. Now, I'm not going to open those up and talk about all of those, but they are some really unique ones. There's even codes for sitting on a knitting needle. Now, I remember some scenarios in the ER where a guy ran a fish bone through his hand because he reached into the throat. He went to throw something away in the trash, and he went in to reach in to push it down a little bit farther or something. And somebody had fish. And what do we know about fish bones? They're serrated, a lot of them, but they also are not like our spinal column. They go off at an angle. So once they go in, they're like arrowheads. You can't get them back out. That was a really, really cool retained fish, you know. Let's see. You're welcome. Yeah, these are these are fun, but the idea, like I've said many times again, and I don't want you to get annoyed with me saying it. Sometimes we don't know what's available to us in the code set until we're exposed to it. And Z codes is the classic example of part of the code set, the ICD-10 code set that is underutilized. It is not taught as much because we teach you how to look it up, but we don't necessarily go through all of the uniqueness that the Z codes offer when you take a course because you're so busy trying to retain the guidelines, both for all the code sets. And just leafing through and exposing you to the codes that are available will help you as a student. It gives you a great refresher, even with you being an established coder, but we also have to remember we know these codes often, but the providers don't. So we need to play the role of provider educator more than ever because they are responsible for the most part now to pick the codes out of the program that they're used, whether it's CERN or Epic or one of the others. There's so many out there, and they don't even know these codes exist or that they're pertinent and needed. They're not thinking statistics. They're not thinking that it has to be identified. They are thinking, medical decision making, but those new Z codes, like we mentioned for statistics, that is not something that they're exposed to unless whoever their administrative department uh, pushes that. And then it's on the back burner. Unless you tell them it's going to affect the money or how they're treating their patients, then they're busy treating their patients. Oh, moving on to with their procreative management. I think we covered all of that. Let's go to the next section. Pregnancy tests, childbirth, childcare instructions. These are pretty straightforward, and you're going to see this a lot in your OBGYN as well as family practice. Then we move on to pregnant state. This is where we're just getting into more statistics. Supervision of normal pregnancy. These are the codes that you'll see with OBGYN. So these codes will counter with all of those O codes that we talk about. Screening for of mother for um, neonatal, and I think most of this is real straightforward. We've got, screening for malformations, fetal growth retardation, isoimmunization and stuff. If you're not familiar with some of those terms, I would go look them up, but this is specifically geared in working with OBGYN. Then some of these, as we move on, we'll get into pediatrics too. The Z codes when you have a single live birth, and this is all based on statistics. So if your children, every time you had a child, uh, a delivery, the Z37 code would be appended. And there are so many multiple births out there that 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 section of the code set has been expanded a little bit through the years. So that's kind of fun. Live born infants according to place of birth and type of delivery. So that and when you code in obstetrics for delivery, uh, uh, it people get worried because there is lots of codes, but the code set surrounding these delivery and stuff is actually quite small compared to some other areas, and it's very, very repetitious. So again, single live born infant born in a hospital. They talk about different places that the baby can be born, and again, being born, whether the baby is live born, stillborn, etc. And then you can have multiples, and some of them survive and some of them don't. And that all is captured by these Z codes. Maternal postpartum care and examination, part of the process. And then we get into weeks of gestation, those Z codes. Now, you don't have to have these codes memorized. If you're working in OB, you're going to have them memorized if you're working for an obstetrician. Uh, but know that you don't have to have them memorized because they're all over the manual in the O codes. They're all right there written in. It's like, oh, by the way, don't forget, you got to do this gestational age. And in addition to to being aware of that, know that for testing purposes, that you'll be able to have your manual, open it up, and it'll reference you to where you need to go. They usually have these in a little box for you. Uh, Z3A is the easiest way to remember. Prophylactic surgery. Now, prophylactic is having surgery before something happens. The one that is the most common in my brain is it has become a I started to say it's become a thing, but it has been very helpful uh, for a lot of women that were BRCA positive to go in and have prophylactic mastectomies. And that is, a lot of them would get cancer in breast cancer in their 30s, sometimes in their 20s, and several women in their family had had that. We did do genetic testing, which was a Z code. My mother had genetic testing because several women in her family had had breast cancer, but and it wasn't on our radar per se. But after she had cancer, and then she was HER2 positive, but she was not BRCA positive. So that was helpful for both my sister and I, but my daughters and my niece to know that that did not run on that side of the family. So that was good, and that's why we have those codes. So prophylactic surgery. There's other ones, but that's the one that comes to my mind. Then we have cosmetic surgery. And you think, well, insurance doesn't pay for those. Why do we have them codes? Because we don't code for insurance companies. We code for statistical purposes. It happens to be a convenient way to get paid for the insurance companies. Okay, so encounter for cosmetic surgery, routine and ritual, male circumcisions, ear piercing. Some people go to the doctor to get their ears pierced. Let's see, for purposes other than remedy, health state, etc. So again, these are interesting codes that you may not have been aware. Now, if you worked for a plastic surgeon, you probably were very aware of Z41.1. If you worked with a urologist, you'd be familiar with Z41.2. Let me just keep an eye over here. It says, let's see, Z30.2 is the only code I've encountered when men got a vasectomy outside of when labs or procedure. Then you've got the Z01.801 pre-op for major surgery like colonoscopy, sigmoid, colectomy. Yeah, and patients with cancer. That, Roland, that is correct. Let's see, the Z01.818 is common when patients get a colonoscopy as pre-op for sigmoid colectomies. Yeah, very good. Thank you. Let's see. Z4 1.1 encounter for cosmetic surgery is more major than people know. You're right. I was I was really surprised. I actually had cosmetic surgery. Gosh, it's been over a year now, whatever. But some of you guys know that I lost 150 pounds. Well, one of the areas that you can't do anything about is your arms. And so I saved up the money and I had brachioplasty and it went well. But guess what? Insurance doesn't pay for that. So that would have been Z41.1. There is a lot of call for different types of cosmetic surgery, and we need statistically to keep that tracked. Let's move on. Breast reconstruction following mastectomies and other plastic or reconstructive surgery following medical procedure or heel injury. HEAL. What is that one? Let's open that up. That one does not ring a bell to me. Is it abbreviated? Healed injury. Okay, I was gonna say, what do they mean? Because heal is HEEL, and I'm thinking, they have to condense that because it's too long. Okay, encounter for other plastic or reconstructive surgery following medical procedure or healed injury. This would be applicable to like what Ronald stated was, it is a plastic surgery. However, like scar revisions, and they can be for reasons, let's say you had reconstructive surgery done on your hand because of a burn and you aren't able to manipulate the joints in your fingers as well, so you go in and it's healed, but you have to go back and have reconstructive or plastic surgery to fix that. And there's other types of plastic surgery that isn't elective, so we don't want to confuse. Plastic surgery is all a area of, um, just doing, facelifts and having, breast augmentations and so on and so forth. This is much more diverse than that. Remember that if you are a cleft palate baby, what are you going to have? Reconstructive and plastic surgery to repair. There are providers that specialize in plastic surgery for this very thing, reconstructive surgery and reconstructive surgery after healed revisions. So, again, there is. I didn't mean to give the impression, and I thought about what I had said, that yeah, it's not all about facelifts and nose jobs. No, this is a very significant area of medicine, that some of it is for cosmetic purposes, that is elective, and some of it is for medical necessity, as well as things like revisions and scars. So we don't want to um, downplay that. All right, moving on. Yay! Encounter for attention to artificial openings. Oh, artificial openings and risk adjustment very often overlooked. And these Z codes, notice they have HCCs over here, little heads up. So you are having, you're there because you're having. You need attention to your colostomy, your artificial opening, to be worked on. And people have complications with them all of the time, but they also just need to be addressed for uh, uh, making sure the skin integrity is still good, and a whole list of things. I can't think of anything off the top of my head, but I know that people that have different type of ostomies, in risk adjustment, again, it's often overlooked, but it is something that if you're on Medicare, you're geriatric, and you're homebound, home health does a lot of work with artificial openings, and these artificial openings sometimes are temporary, and sometimes they're meant to be there for a long time. Now we have encounter for fitting adjustment of external prosthetic devices. So we've got artificial limbs, eyes, external breast prostheses, and just a heads up for our students that are watching. Prosthetic could be referred to as, that's the term also used for artificial joints. So a prosthetic knee is a knee replacement. There can be complications to those. Let's see, implanted device. And again, you may not have even realized all of the different devices that can be implanted. So that would be a good place for you to check out. But one of them is cardiac devices. So this is where uh, you get pacemakers, defibrillators, and there's other cardiac devices that are put in. Watchman device, things like that. But note that things like pacemakers and defibrillators, those are done electronically, and they have to be calibrated and checked on the battery life and a bunch of other interesting things. Now going into adjustment for things like contact lenses, hearing aids, dental prosthesis. So you got artificial dentures, but there's other prosthetic devices, and it really is quite a broad. We're going to skip through these pretty quickly. Um, okay, aftercare. So orthopedic aftercare, you had your knee replaced, and this will fall under that section. Post-procedural aftercare for, again, having stitches taken out, having drains pulled, looking at wounds to make sure they're healing, following organ transplant. You'll have a lot of aftercare after for that, for neoplasm surgery. Uh, Renal dialysis, so they set you up for renal dialysis, and then testing for your dialysis status. After other medical care, chemotherapy, palliative care. If you have entered palliative care, let's see, desensitization to allergens. Do you have any idea what that is? So put in the chat if you guys know what that is. Oh, Carol says retained metal could be gunshot. Actually, yes, that could. That would be a retained metal could be a gunshot. And you know what? They don't always take those things out. We know that because of what, um, um, you're gonna laugh at me. Uh, who's the guy in the red suit? Anyway, because he had the bullet, right? And that's why he had to have that magnetic thing sticking to his chest. Iron Man. Moving on, organ donors for organs. So again, you can be a blood, skin, bone marrow, kidney, cornea, liver. All of this tells you, one, that you could donate as well as be recipients for those particular organs. So that's good to know. We are going to speed up a little bit here. Uh, Persons encountering health services for specific procedures, treatments not carried out. So this one comes to mind. Procedures converted to open procedure. So we plan to do laparoscopic procedure, and then it was converted to open procedure due to XYZ. That is one that you could see in testing. Let's see. Related to education and literacy, this a pretty interesting less than high school diploma. Why would that be applicable? Or failed school examinations. Why would that be something that we would be keeping statistics on? If your child is not doing well in school and you don't know why, then they could say, again, we need to be tested. And then they determine that your child has either a cognitive disorder, a learning disorder, or maybe that there's something else going on. I am going to just jump. Let's jump because I don't think we need to read all of these. And now we've already gotten to specific socioeconomic, do not resuscitate, body mass index, health hazards. Let's look at these in more specificity. Long-term current drug therapy. Remember, we have Z79 is where Z79.4 long-term use of insulin. We've got coagulant, long-term use of that. We've got long-term oral uh, anti-diabetic medications. Let's see, family histories. This is very pertinent, and you're going to use these a lot in your everyday coding life. History of family history, personal history. Don't get them confused, but family history of malignancies, right? So my chart would show that my mother, family history of breast cancer, and that's would indicate why I would go in and have more screenings done. Chronic diseases, and let's see, personal history and family history. That if you get those confused in testing, that's an area you want to be very cautious about. Allergy status to drugs. Um, So a patient that is allergic to a specific drug, acquired absence of a limb. These are amputations. So you got BKAs, AKAs, and just heads up, lower limbs, risk adjust, even toes, if that's what you're working with. So these are often missed HCCs, but and you'll see BKAs and AKAs mentioned a lot of times next to BMIs in the where you're doing uh, capturing that or abstracting that content. Acquired absence of part of head and neck. Now this gives an example of some of the funny things that you can come up with, but again, acquired absence of organs. Why would you have an acquired absence? Because you had a kidney removed or a lung removed, or you had a spleen removed. Now, acquired absence is different than congenital absence, that you were born without them. So don't get confused there. Let's see. Patients' noncompliance with medical treatment and regime. I've seen this Z91 code used sometimes with patients that are not taking the their diabetic medication correctly, and they're having complications. This also doesn't mean that the patient is being spiteful or negative. It could mean cognitively they're not capable. So they're non-compliant, and they want to track that, saying, you know what, it's time for this patient to get assisted living because they've been non-compliant with their maintenance medication. Therefore, they've had these complications. Or again, it could. It's something that they're trying to track to keep a record of statistically, as well as to show the disease process and taking care of your patient. Let's see, personal history of self-harm. That's not new. It's been around for a long time. Other specified personal risks is in there. We're wrapping up. Personal history of contraception. Let's see, drug therapy, history of ir- irradiation. You've been irradiated, um, and of other medical treatment. Again, just peruse these. These are artificial openings that we already went through. Now, the other time, those codes were for encounter 4, meaning we were treating or working on that ostomy. This is the status. So, of course, if you're having treatment to address the encounters to address your uh, colonoscopy, not colonoscopy, uh, ectomy, then again, that you would be in your record that you were a Z93.3 because you had a colostomy. Transplant status, very important. Another often overlooked. These are all of the organs that can be transplanted. And this not only is it pertinent because we're tracking it for statistics, but we also it takes precedent in medical decision making for your providers, all these codes, and the plan of care for your patient. You're immunosuppressed. You have to take immunosuppression drugs from the point that you have a transplant. So all that's pertinent. Presence of a pacemaker. My favorite one that is overlooked is other Z95818, I think, or 811. Presence of cardiovascular assistive device. It actually risk adjusts. And 95818, I think, is what it is. I always wait to see if that's going to be one that I get to use. Uh, let's see, more implants and artificial eye, contact lenses, etc. We're just wrapping up, guys. Sterilization, a genoplasty status, cataract extraction status. Some of these, again, you're not going to see on your regular primary care. The dependent status, renal dialysis is probably one of the most common ones that I see here, is that, your patient is an ESRD N18.6 and they are a Z99.2, therefore, because if you have end-stage renal disease, you have to have renal dialysis. Okay, wrapping up those code. Oh, that's not Z codes, but um, um, I think that's it. Yep, your dependence codes are the last of those codes. I am going to move this out of the way now and just show you that I was able to find those via Find a Code. That was a great little tool to use, and um, fun. I really enjoy Find a Code because, um, one, when I look up a code, they're easy to find with all these little great tools that they have. However, they often give a description with additional information, and I use that quite a bit in teaching. But it helps me understand and also how to articulate that to our students in a better way. So, thank you guys for joining us. And you want a practice manager's update video? Yeah, we'll work on getting some of those for you. And thanks, Ronald, for joining us, and everybody else. It was really great to see your comments. We love doing CCO lives. I think we're having one again next week, which is uncommon. But any topics that you want to see, Ronald's already got his input in. I think he said something about that last time. So if you have a topic request, go ahead and put it at cco.us/topic hyphen request, and we'll get you on the list. Thanks for joining us, guys. See you next time.